When I think about the Cardiovascular Center, I think about three things. I think about excellence, collaboration, and about the patient. We're the largest advanced heart failure and cardiac transplant program in New England, among the top 10 in size in the country, and more importantly, we're one of only 8 centers in the country that gets the highest rating for our heart transplant outcomes. So excellence is really what we're about first and foremost. Our docs across the different disciplines, cardiology, cardiac surgery, vascular surgery, interventional radiology, anesthesia, infectious disease, we are aligned organizationally to really deliver care in unison and pick the best diagnostics and therapeutics for the patient in front of us, which is a special thing. That's not true in every organization. The second thing is collaboration. Our Cardiovascular Center has a unique structure that really fosters collaboration across multiple specialties. In recent years, more and more of what we do is moving out of the operating room into the catheterization laboratory, or what's called the hybrid room, to be able to do some of the things that we could only do by cutting a patient open. And we can now do them with catheters, which are, thin tubes that we can thread up through an artery and a vein. And originally we could only do diagnostics with that, but now we're well into therapeutics. It's really revolutionary, and it's a sign of things to come. I think about our researchers in cardiac imaging who did some of the landmark work in three-dimensional cardiac imaging with echocardiography. That's a technique now that's used across the country to guide cardiac surgeons in the performance of complex operations. And in our Molecular Cardiology Research Institute, they have been painstakingly exploring the underlying basis for vascular disease for 2 decades now. And that research is now pointing the way to new treatments for hypertension and for atherosclerosis. We're an incredible interdisciplinary team that includes not only physicians, but nurses, nurse practitioners, physician's assistants, administrators, perfusionists, case managers, pharmacists, dietitians, many different disciplines. And every one of those people, in my experience, every time they walk into this place, they've got one thing on their mind, and it's how to take care of the next patient they see. What does the patient want? I think that's something that we ask ourselves every time we see a patient. They want to be active with their family. They want to travel. They want to go back to their vocation. They want to do sports. And we try everything we can, to bring the patient the quality of life that he or she is looking for. It's something very important to us. I'll give you the example of the 40-year-old mother of 3 who was sent to us with virtually a dead heart and life-threatening shock. And because in our institution, we're one of the leading centers in the country in developing new mechanical support devices, she was one of the first people in the country to have insertion of a temporary cardiac pump on both the right side and left side of her heart. And that saved her. That allowed her to recover, and she was able to return to her family with complete recovery. I think about the 36-year-old gentleman who couldn't play with his children anymore. He was so short of breath because he had an overgrowth of heart muscle obstructing the flow out of his heart. And he came to us because we have one of the top programs in the country in his disease, which is called Hypertrophic Cardiomyopathy. He underwent a delicate procedure to shave off that obstructing heart muscle, and he was able to return to his family and teach his children how to play baseball. I think about the 15-year-old young man who had a cardiac arrest while playing basketball. He came here, and he was the first in New England to receive a pediatric subcutaneous implantable cardioverter defibrillator. It's a device that prevented future cardiac arrests, but it was placed under the skin instead of inside his heart. And as a result, he could go back to playing sports again. And maybe my favorite story is a 33-year-old rodeo star who had a stroke and was told by his cardiologist in Amarillo, Texas, that he would never rope again. An ESPN reporter did some research and found that we're one of the leading centers in this area for holes in the heart that can cause strokes. He came here and our physicians used an investigational device to close that hole. And in no time, he was back in the saddle again, pleasing crowds. The metric for our success is improving the lives of the patients who trust us with their health care. I just want to say thank you to everybody who supports us. It means the world to us, and more importantly, it means the world to our patients. And we're just so grateful, to the people who support us. I'm Marv Konstam, and I'm the Chief Physician Executive of the Cardiovascular Center at Tufts Medical Center.